Hello, I am Dr. Mark Dailey, and thank you for taking a moment to tune in to our video series on thyroid conditions. As I mentioned earlier, I am a doctor of chiropractic that helps people overcome chronic conditions like yours, all naturally. I graduated from Life University in 1996 from Functional Medicine University. I have advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and mastering the thyroid. We're starting on our first part, really getting into the meat of the issue of our first part of the video series on thyroid conditions. I'm going to cover the three most common thyroid conditions and their symptoms, why your medications aren't working, 6 reasons why your thyroid tests are normal but you still feel horrible, and the autoimmune connection to certain thyroid conditions. Now, it may seem that we're starting out a little bit slow, and we are, but I need to lay a foundation that we can build on, leading to what we look for from a clinical perspective and how we deal with each issue from a nutritional and metabolic standpoint. The most important thing to remember about the thyroid gland is that it's very sensitive, and it's sensitive to slight alterations in the body. When the thyroid malfunctions, and it does this for about 27 million Americans, the thyroid is without question probably the most complex hormone-producing endocrine gland in the body, which is probably why so many people don't fully understand how it works. There are a lot of frustrated women out there that suffer from all the symptoms of hypothyroidism, yet their lab tests are normal. The other possibility is that they've been put on medication which either never worked or worked for a while, then the symptoms slowly came back. Because each system of your body is interdependent on the other, and each gland is dependent on the other, it's possible to have a healthy thyroid gland yet suffer from all the symptoms of hypothyroidism. Now, do you remember as a kid lining up dominoes in a row very carefully so you could push them down just to see the fall, to see the chain reaction? Well, your entire body is set up like that, in the respect that if one area malfunctions, it'll affect the other. Now, with the body, it's like the dominoes are set up in a circle, and no matter which one you push down, it'll eventually affect them all. So, a GI or a gastrointestinal condition will affect the thyroid. A liver condition can affect the thyroid. An adrenal issue will affect the thyroid, and of course the thyroid will affect each of these systems. So there are 3 main thyroid conditions we're going to consider for the sake of this series. Hyperthyroidism, also known as Graves' disease, hypothyroidism, and Hashimoto's thyroiditis. Now, Graves' disease is the most common form of hyperthyroidism, occurring when your immune system mistakenly attacks your thyroid gland and causes it to overproduce the hormone thyroxine. This higher thyroxine level can greatly increase the body's metabolic rate, which may affect you in a number of different ways, your mood to your physical appearance. Graves' disease is rarely life-threatening, although it may develop at any age and in either men or women. Graves' disease is more common in women and usually begins after age 20. The symptoms of Graves' disease may include anxiety, irritability, difficulty sleeping, fatigue, a rapid, irregular heartbeat, fine tremors of your hands or fingers, an increase in perspiration, sensitivity to heat, weight loss despite normal food intake, brittle hair, enlargement of your thyroid gland or goiter, a change in menstrual cycles, frequent bowel movements. Now, this is the condition that I see the least frequently in my office. So really, we're going to be concentrating on hypothyroidism and Hashimoto's for the bulk of our time. When we talk about hypothyroidism, it is an underactive thyroid. Hashimoto's is an autoimmune disease that can cause both symptoms of hyperthyroidism and hypothyroidism. So let's talk a little bit about the symptoms of hypothyroidism and how you can know if you have undiagnosed hypothyroidism. So although I do use blood panels, blood chemistry panels, a person's symptoms and health history are extremely valuable, especially in this type of condition. Now, here are the most common symptoms of hypothyroidism: fatigue, weight gain, morning headaches, depression, constipation, hypersensitivity to cold weather, poor circulation and numbness in the hands and feet, muscle cramps while at rest. Excessive amounts of sleep are required to function properly. Chronic digestive problems, itchy, dry skin, dry, brittle hair or hair that falls out easily, the accumulation of fluid in your face, loss of the outermost portion of the eyebrow. Now, it's reported that 80% of those that suffer with hypothyroid symptoms actually have Hashimoto's, which is an autoimmune condition. Now, you need to get that. I said 80% of those that suffer with hypothyroidism actually have Hashimoto's, which is an autoimmune condition. Remember what an autoimmune condition is. An autoimmune condition is when your own immune system attacks parts of your body. Now, traditional medicine treats Hashimoto's disease just like they do hypothyroidism. Now, from a functional medicine perspective, we have tremendous results supporting the immune system in Hashimoto's, and quite often we see all the symptoms reduced dramatically. The symptoms of Hashimoto's are the ones that I mentioned earlier, and like heart palpitations, inward trembling, increased pulse rate even at rest, feelings of nervousness and emotional distress, insomnia, night sweats, difficulty in gaining weight. Now, keep this in mind. In an autoimmune disease, we see the symptoms wax and wane, which in essence means they come and go. So you may have symptoms of hyperthyroidism at times and hypothyroidism at other times. The thyroid is, as I mentioned earlier, extremely sensitive to the slightest changes in body chemistry. And after all, that is its job, right? To detect these subtle shifts in physiology and compensate for them. When these shifts become chronic, the thyroid can falter and fatigue. On the next video, we're going to talk about the causes of hypothyroidism. And let me again say before I conclude this segment that if you're suffering from a chronic condition, whether it's your thyroid or something else, I'm going to offer you a free consultation in my office, which is normally a $275 value. We have a waiting list, and I only accept a limited number of new patients. So call the office right away. And really my hope is, in this video series, to add value to your life, to reduce your frustrations, and to ultimately help you reach your full potential and fulfill your destiny. Thank you so much for your time and attention. God bless, and have a great day.